everyone, welcome back to PCOS Diaries. I'm your host, Ira Bagga, and I'm so glad you're tuning in for another episode. PCOS is something that affects so many people, and still there's not information about it. That's why we're here, to talk about it openly, share different perspectives, and learn from experts. When it comes to PCOS, there's no one-size-fits-all answer. Everyone's experience is different. Some people struggle with irregular cycles, others have insulin resistance, and for many, the hardest part might be communicating with their doctors about their symptoms. That's why it's so important to hear from professionals who really understand the condition. So today I'm joined by Dr. Duru Shah, a women's activist and gynaecologist professor from Mumbai, India. In addition to being the founder and president of PCOS Society India, she advocates for the health of Indian women and teenage girls. I'm really excited to have her here to break down things in a way that makes sense and talk about what matters when it comes to PCOS care. So let's get into it. Dr. Duru Shah, thank you so much for being here. Can you start off by telling us a little bit about yourself and how your journey with PCOS began?
Well, I'm a gynecologist by profession, and my basic interest is in more of reproductive endocrinology. And hence, I focus my attention on issues which are related to hormonal disturbances, which includes infertility, includes PCOS, it includes premature menopause. So when it comes to PCOS, I knew that there was not enough information available even to the medical profession and even to the lay people. So 10 years ago, I decided that we must create an organization which is called the PCOS Society of India. And we brought in all the multidisciplinary experts which deal with PCOS under one umbrella. The intention being is that women or young people also with PCOS, they do not get a diagnosis right away. When they have acne, they have facial hair, they end up with a center where they treat the acne and they treat the facial hair. But it keeps coming back, and they don't know why. And then they have menstrual irregularities. They don't bleed for 2-3 months and then suddenly bleed heavy and they don't know why. So in short, there is so much of I'm talking about 10 years ago, there was so much of no clarity on the subject. And even I think one of my colleagues, Anuja Dokras in the US, has put up a paper saying that it takes almost 5 years for a girl to know when she's got PCOS, because she keeps going to multiple doctors. So I thought having this organization with all the people involved who are managing PCOS is something which was needed. And that's why we created the PCOS Society of India.
Yeah, that's really cool. And I think it was especially needed. And having more organizations like that would be really good as well. How exactly do you guys go about sharing awareness and also having more diagnosis and stuff like that?
I thought it would be a good idea to educate all the physicians also at the same time, making them aware of what really is PCOS, why it occurs, etc., etc. And so we were busy having educational programs for various disciplines of medicine. So we worked with the endocrinologist, with a nutritionist. We've created programs for fertility. We've done a lot of education for doctors. And today I'm glad to say that most of the doctors know what is PCOS. Though some people still by mistake call it PCOD. And PCOD is the old terminology which we don't use any longer because it stands for disease. Mm-hmm. And disease is something wherein about it's something which we can correct or treat. While syndrome is something which you have various symptoms. You don't have any one symptom. Say, for example, if you've got malaria, you have a diagnosis, you give anti-malarians, a woman is fine. But if you have PCOS, there's no one treatment for it. We treat the patient or manage the patient according to her symptoms. That's what we do. So in short, there is no cure as of now. But yes, it's a condition which involves multiple organ systems in the body, and therefore you need multiple doctors to understand what it is. So in short, we have educated doctors, and for the last few years, we were doing a lot of social media. But there is a limit to what an organization, which is a charitable organization running on funding, we could do as just this much. But in the last 2 years, we were very fortunate to get a grant from Philips India, and they gave us a grant to reach out to patients. And for the last 2 years, we've done an amazing amount of work with patients, with people, both physically, virtually, on radio, on the road. We have done a whole lot of stuff, and I think we have created a lot of awareness. So if you look at our website, if you look at our Vijayata program, it's called Vijayata, which is the winner. And that program is reaching out to people, both in colleges. We reached out in corporates, in colleges, in various, Rotary clubs, Lions clubs. We went to schools. We've been talking to every possible person. And I think all that is very well encapsulated in our Vijayata program, where our public outreach is concerned.
Mm-hmm. That's really cool. And I think like the way you guys do it is super important, especially teaching like healthcare professionals too. And
Yes.
since you mentioned like in the past 2 years, there's been so much more awareness and stuff. How do you
Yeah.
think PCOS, the way it's researched and like discussed, have you seen any like differences in how it's been discussed in like the past 10 years in India?
It's discussed definitely as though it's a condition which people should be aware of. We all, sort of want to actually do. The thing is that it's come out of the, it's out in the open. People were very embarrassed talking about PCOS. They were very embarrassed about saying I have PCOS, especially young people where there was a lot of mental health issues, a lot of body image issues, and girls did not want to talk about it. So this is something we have been able to now openly discuss. And one thing we realize that the Indian ethnicity is different from American, from European. We have different phenotypes. We have women presenting in a different way. And India being the one of the topmost countries to have the maximum number of diabetics in the world, I think PCOS is a subject which is of great importance to our country because we know it's a high risk factor for diabetes. So many of our young girls are also having insulin resistance. It's unfortunate, but very young girls do have it.
Yeah, that's definitely a really big problem. I see it like in America, diabetes is also like very much on the rise. So that's
Hmm.
definitely like a big problem.
Okay.
Um, what like challenges do you think you faced in educating more people about PCOS?
In educating people, women,
Have
yeah.
there been any challenges?
So we have tried to study the impact of our education. What we did is we conducted sessions with women, virtually, physically, as I told you, and we put up a questionnaire which talked about how much they knew about PCOS. So we talked about, we put up like a little quiz, and we put it up before the session and we put it up after the session. So before the session, approximately 60% of the women had heard about PCOS, but they really didn't know what it was. But at the end of the session, it rose to 90% of the women understood what was PCOS and what it meant. So in short, that is how we assess the impact of our education, which went out to thousands of people. I don't have the figures with me now, but it's thousands of people, whom we educated. The second thing we did is we wanted to understand what is the prevalence, like what is the possibility of women in our country having PCOS, because there are various statistics from various studies. So this was a general questionnaire which we put up in as a yes and no answer to know. Okay, something like, do you get a lot of acne? If the answer is yes, we know that there is some increased male hormone in the body. If we ask a question, do you have irregular periods? We knew it is going towards PCOS. So similarly, 8 questions, and out of 8, we said if 4 are positive, then we know that probably this woman has PCOS. So this is how we assessed, and we came to a conclusion that probably 1 out of 5 women in our country have PCOS, and it's that common.
Oh,
And these are girls, young age between 18 and plus, and with a mean age being about 25 to 30 years of between adult women and young women.
That's
So it's
really cool that like the education definitely works, and it's really also interesting how you find that like there's so many differences everywhere, especially like in India versus America, and like even with like how they think about it and stuff like that. Um, and could you also explain the causes of PCOS to the viewers?
the causes. Okay. Now, the causes we haven't really been able to evaluate as to what is the cause, but whatever research has been done, it shows that only 5 to 10% of women are likely to be genetically having a problem, though the exact gene has not yet been identified as to which gene is causing it. They found different genes being mutated in different women, and therefore we don't have a single answer as to which gene is being affected. Just like you have it, say, for thalassemia, we know which gene is affected, we know what is to be done. But here there is a variety of publications which talk about mutations of different genes, and therefore we don't know which is that one gene which is causing the problem. But we know for sure that there is an effect epigenetically on the baby if the baby is in the womb of a mother who's actually, sort of having PCOS herself, but she's not controlled with her hormones when she gets pregnant. So, in short, this is the problem with women who do not go and see the doctor before planning a pregnancy, but they get pregnant and then they come to the doctor. And that's what we usually see in 90% of our patients who come to us after getting pregnant and say, Doc, I'm pregnant. So, if they do not know that they have PCOS, and if they know that they have PCOS, but they have not controlled all their hormones and all their imbalances before getting pregnant, then what happens is that imbalanced hormones are playing around or causing epigenetic changes in the baby which is in the womb for the next 9 months. So that baby, when the baby is born and their tests are done, this is based on clinical research, they found that these babies are likely to be having a higher male hormone in the body, a higher AMH in the body, etc., etc. Even the male children are found to have those issues. Now, as these children have been followed up till the age of puberty and even beyond, it's been found that excessive weight which they put on, if they put on a lot of weight, that's one risk factor for developing PCOS. It's also that these children may be having insulin resistance, and that there have been children who have already been put on metformin or an insulin sensitizer even at the age of 8 years. So, in short, it's been seen that women who have not controlled their sugars, nor their insulin their resistance, nor their obesity before getting pregnant, those are the babies who are likely to have a higher risk of developing PCOS because of epigenetic changes. Though we've seen it running in families. It's not that we don't see it running in families, but it's not a particular gene which is getting affected. Mm-hmm. That's exactly what I'm trying to say. So the message going out is that every woman who plans a pregnancy, I think this must go out to all the young people in the world, that you must make sure that when you're planning a baby, please see the doctor before getting pregnant, because there are so many small intricacies which you need to take care of so that you make the environment for your baby as healthy as possible so that the baby does not have those children grow up. So this is the message I would like to send to all the PCOS women or all women, even non-PCOS. It's a simple tablet, like say for example, if they have a folic acid deficiency, that deficiency can cause severe abnormalities in the brain development of a baby. And folic acid is just a vitamin. So if they see the doctor will start them on folic acid and will give it to them, will guide them. And then we say, make sure she will do all the tests to make sure that the patient is healthy enough to go ahead and get pregnant, and then get pregnant. Because after all, it's the future of your baby. And that's the message I want going out.
Yeah, I think that's extremely important, and it's definitely not talked about enough because a lot of people just don't like bring up how important it is to see your doctor before just getting pregnant or planning a pregnancy. But that's definitely super, super important no matter like what the condition is. And with your background in reproductive endocrinology, what's something about PCOS and hormones that you think that people often misunderstand?
Mainly with PCOS, it's like this, that how we make the diagnosis. There could be three criteria we look into. One is that irregular periods. Second is that having, higher male hormone in the body. And third is having ovaries which look like polycystic ovaries. The ovaries are enlarged and there are multiple follicles inside. Now, if you have two out of these three positive, if you're 18 plus, and two out of these three factors are positive, we say that you're likely to be having PCOS or you have PCOS. But if it's a young girl who's under 18 and she's got a lot of acne and she's got, sort of irregular periods, it could just be because she's reached puberty and that is the age when girls have these issues. And therefore, we don't make a diagnosis at that age because this could be normal and physiological. We do not wish to label a young person as a PCOS when she doesn't have PCOS. So we wait till she's about 18 or we wait for at least 8 years after her puberty to make a diagnosis. And this is based on international guidelines of which I've been a part of, very luckily for me. It's a global conglomeration of experts on PCOS from different parts of the world. And in 2023, we published the latest guidelines, and those are very clear. How do you diagnose a patient with PCOS? Now, when we talk about the male hormone, it's not necessary that it has to be in the blood. It can be even clinical. It could be where a girl has got tremendous amount of acne on her face, which just don't go. She uses local therapy, she uses medication, she's okay till then. But then it comes back again. So it's an imbalance of hormones in the bodies, wherein the ovaries are producing a little higher male hormone, which is causing this problem of acne, facial hair where normally men have hair, and like say the chin, the beard area, midline of the chest, lower part of the abdomen, below the umbilicus. So these are the areas where women normally don't have hair, but PCOS women may have it. So that is the second thing. And if at all there is no clinical evidence of hair, then it could be that it's in the blood that the male hormone is high. Either way. So we have to have two factors positive. Now, if I do an ultrasound for a young girl, and if I see that the ovaries are larger than 10 ml in size, or they have more than 20 eggs in each ovary, then I know this is a polycystic ovarian morphology, a look. And if two out of these things are present, that's the irregular periods, and if the presence of evidence of male hormone being high in the blood, and the third is where the what was I saying? One is the polycystic extra male hormone, and the third is the irregular periods. Any two out of these three positive, then we say she has PCOS.
Okay.
So diagnosis is extremely important, and it's so simple now to diagnose that once you have any of these two factors present and you're above 18, I think you should just visit the doctor to confirm your diagnosis.
So you said you are under the guidelines, you don't diagnose anyone under 18. But how often do you see these symptoms of PCOS in younger than 18 women?
I didn't get the question. Can you please repeat?
Oh yeah.
How often?
Yeah, how often do you see symptoms of PCOS in women that are younger than 18, even though you don't diagnose them?
Yeah, we see it quite commonly. We see young girls who are, having a lot of acne. We see girls having facial hair. But what facial hair is, what we have to look at is very thick facial hair. Like how men have in their beard or how women have in their eyebrows. The soft hair which you see on your body is genetic. It's something like some communities have extra hair on their body. We don't look at that. We look at hair where men have hair. So in short, if you've got very thick hair on the skin in the upper lip, you say that probably it's a increased male hormone in the body. Now, increased male hormone can be due to various reasons. So it's not only in PCOS that you will get it. So in short, when we do PCOS diagnosis, we also rule out other hormonal issues like hypothyroidism, or we talk about even hyperplasia of the adrenal glands. So there are other differential diagnoses we have to look at and then make a conclusive answer for the patient. So one thing is for sure, such young girls, if I find with these kind of symptoms or irregular periods, I always tell them, please don't put on weight. because 80% of the girls who put on weight are the ones who have the major problems. Whilst 20% girls remain lean and they may still have extra facial hair, they may still have acne and still have irregular periods or still may have polycystic looking ovaries. But we always tell them, you must be alerted, you must, watch how your periods are coming, help them with their periods. If the periods are too erratic or they're bleeding too heavily, we help them. But we only conclude a diagnosis is after they are adults, because by then everything settles down with the ovaries. And every young girl doesn't get a period at 12 or 13. So many girls reach puberty at 14 or sometimes even at 15. But that's the average age is about 13, 12 to 13 years. And the more weight you put on, the earlier the period comes.
Okay.
That's
You said that like putting on weight can also increase the symptoms or make them worse or harder to manage. How would you say, like, how can young women, not necessarily under 18, but just in general, how do you think they should change their lifestyle to help with PCOS and like overall health?
That is something so much needed today, because I'm seeing young people constantly on their phones, Facebook, WhatsApp, and everything is on the phone. And I think people have to stop doing that. I've seen young people, awake at night, sleep for hours on the phone, and they sleep at 2 in the morning, and then they get up late in the morning, and then they've got no time to exercise. And I'm very clear on this, that the digital medium is good for education, but it can also have its own negative effects, that where a lot of people are spending too much time on the phones or their iPads or on the computers, busy chatting, busy just surfing. And it's unfortunate that the lack of exercise which is occurring because of being, sitting in one space. And whilst they're doing that, they're munching on chips and they're munching on wrong snacks. And that causes the obesity. It's the inactivity, it's the wrong diet. And I think our children should, or young people should be out there playing more sport, playing, dancing, playing games, doing whatever, but physical activity for an hour a day is a must. That is the message again. Second message going out to young people: don't waste your time on all the social media. It's fine, it's okay for some time, but not all your time. And one thing is there, they're sitting up at night doing this. And we know scientifically that if you're exposed to light for a long time, which comes from the phone or from your comp or from your iPad, that light prevents the formation of melatonin in the brain. And melatonin is a hormone which helps you sleep. And if you're on the phone for a long time, that melatonin is not getting produced. So when you try to sleep, you won't sleep. And then you sleep at the wrong time. You sleep in the day rather than at night. So in short, the sleep pattern gets disturbed, eating pattern gets disturbed, the mood changes, all the mental health issues come up. People are getting depressed, people are getting anxious, people are having eating disorders because they put on weight and they're concerned, they don't eat at all. There are some who are going into anorexia, some having bulimia. I think there are a lot of issues which are associated with PCOS. And mental health is another major issue which we are finding. And it has been proved scientifically that there is increased amount of mental health issues in a person who's got PCOS. And I think that's something we definitely have to, prevent. Prevention is the key word today till we have an answer to why it's happening.
Yeah, I definitely agree. And especially like exercise and physical activity is very important, no matter if it's PCOS or something else.
Exactly.
But yeah.
Exactly.
I was also wondering, like on the other side of the age spectrum, you've been involved with the International Menopause Society. So how does PCOS affect women during menopause?
So you see, I'll give you the life story of a young girl who's probably had PCOS. She's 18. She's got irregular periods probably. She's got cosmetic issues. She's got mental health issues. So there are girls who are on antipsychotic drugs. They are exercising. They're doing whatever needs to be done. But the PCOS keeps bothering them. And then as they grow, they are taking medication because they have to keep everything under control. Then they get pregnant, the pregnancy, they start putting on weight, and then they do develop, they are already insulin resistant. They become pre-diabetic, then they become diabetic. They develop dyslipidemia, that is high cholesterol values, etc. And then they have high blood pressure coming up. So as they get older, by the age of 40, when you see a woman, when you see her ovaries, the ovaries have started shrinking. So you may not realize that she's had PCOS. She may never know that she had PCOS. But she's come to you maybe the first time then, and she's got hypertension, she's got high cholesterol, she's got, all the probable non-communicable diseases, obesity, etc. Now, if she doesn't take care at that time, now she may be PCOS, she may not be PCOS. But as she approaches menopause, her periods start getting later and later. A PCOS woman actually would have had irregular periods before, but because her ovaries are aging by the age of 40, 45, her periods become normal. So she thinks everything is fine. But at the same time, those imbalanced hormones inside her body are bringing on all these non-communicable changes which give her a lot of morbidity. In short, she's developing obesity with all its after effects. She's developing diabetes with all its after effects. She's having hypertension. And all this leads to cardiac problems. So women between the age of 50 and 60 who have got all these problems and have not controlled it, then there's a very high risk of having a cardiovascular problem. A cardiac, sort of event can occur which can cause a major issues. So this is something which we have to bring up and tell young women that as they age, as it is when you get menopausal, there is a little imbalance of hormone in the body. There's no estrogen in the body. You are having, imbalance of the hormone, and there is some amount of weight you put on around your waist. And today the waist circumference has become a very important factor because it talks about how much fat you're having within your body. We always talked about BMI. BMI is the body mass index. It depends on your height and it depends on your weight. But your waist circumference is something which remains steady. The more waist, your higher the waist circumference, more is the obesity or the fat inside your body, which invades into the liver, which causes gut problems. It causes major, sort of digestion problems. It's called gut dysbiosis. So these are the little things which keep happening. The liver gets fat infiltrated into it, and if you don't take care, the fat goes on accumulating, finally causes a liver failure. So these issues are the ones which bother them later. And then, of course, there's something called obstructive sleep apnea. The more weight you put on, the more is a chance that you have problems in the night sleeping. And when you sleep, you are not able to breathe properly, so you start snoring. And then when you snore, it's typical snoring. Snore, and then suddenly stop breathing. And then there's a period when they are not breathing. And that's called obstructive sleep apnea, wherein sometimes it can harm you tremendously if you're not breathing for a little bit of time. The carbon dioxide collects inside and then you have issues related to that. Then, of course, if you have prolonged period of no period, a prolonged time of no period, and the woman thinks she's menopausal, she doesn't go for a checkup. Till one day she starts bleeding. And then she gets alerted, she sees the gynae. And when she sees the gynae, she realizes that the lining inside her uterus has been building up and building up and building up. And then one day it just comes out as blood. So she's developed something called endometrial hyperplasia, which can then lead to endometrial cancer. So this is what I'm trying to say, is that we need to regularly check up once a year. Every woman, as she approaches menopause or as she goes beyond the age of 40, she must see her gynae or her primary care physician at least once a year. Get a pap smear done, get the breast examined, if necessary, at least a baseline mammography, if needed. It depends on the risk factor of a woman. But once a year, at least a medical evaluation to see whether her blood pressure is normal. Has she got any diabetes? Is there any, cholesterol issues? Is it going to affect her heart? So a yearly checkup, whether she has a problem or doesn't have a problem, is a must. She must have her pap smear done. Every country has their own guidelines, and every country has guidelines for a health evaluation. So whatever is working in your country, please do it. See your doctor. And there are some countries where if the woman doesn't go for a checkup and she's found later on to have a cancer or found later on to have a problem, then the insurance doesn't cover it. So I think that is a disincentive which they have. So the countries where such issues exist, women tend to go for a checkup because they are concerned that if something happens, they won't get covered by insurance, and medical treatment can get very expensive nowadays. So in short, I feel whether there's a compulsion or no compulsion, see your doctor. As you approach 40, 40 plus, there are few things in life we are looking at. We are looking at whether you're developing obesity and its after effects, whether you are having high cholesterol, which will affect the heart. Finally, with all the abnormalities which occur with it. If you have hypertension, you may be ruining your kidneys. If you've got diabetes, you may be affecting all the organs in your body because diabetes works at every level. So many issues can be there. If you're not exercising, your bones are taking a hit and your muscles are getting wasted. So you need to do exercises which help your bones to remain strong, your muscles to remain strong, and to prevent any fractures in future. We do a bone density. So in short, we are looking at women once a year, making sure she's not developing a cancer, either of the cervix or of the breast or of the uterus. We are, as a woman, as a gynecologist, I'm talking about gynecological issues. We are also looking at diabetes, hypertension, high cholesterol, what we call the metabolic syndrome, which can affect the heart. We are also looking to prevent fractures of the bones. We are doing all this. But the PCOS women, the problem increases a little bit towards causing problems for the heart. So I think we need to definitely educate women that right from the time they are young, they need to prevent obesity, they need to be exercising, eating healthy, so that it does not affect, all the phases of their lives and their future. But at the same time, preventing problems for the next generation by making sure they are okay before getting pregnant.
Mm-hmm. Yeah, I think that's really, really important. And I've not really heard a lot of people talk about like PCOS after menopause. And with the symptoms being like so extreme, I think that it needs to be talked about like much more, just like you're doing. And just to close off, Dr. Duru Shah, thank you so much for sharing your knowledge and breaking things down in such a clear way. I can't believe that I got the opportunity to have you on this podcast and collaborate with PCOS Society India and the Vijayta Project. So my sincerest thanks for giving me and our viewers your time. I hope many like myself will be inspired by you and how you are one of the biggest global advocates for PCOS. But for now, that wraps up today's episode of PCOS Diaries. PCOS can feel overwhelming, but conversations like this remind us that there are real ways to manage it and that young women are not alone in this journey. So to our listeners, if you found this episode helpful, be sure to subscribe and share it with anyone who might benefit. And if you have any questions or topics you'd like us to cover in future episodes, please let us know at Breaking the Cycle. See you next time!